nutrition, 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 nutrition.
Good morning, everyone. My name is Marjorie van Wyk, and I'm the nutritionist at the Ministry of Health and Social Services. So I've been working in this field for many, many years, and in nutrition or dietetics, you have three disciplines basically. Okay, so one is community nutrition, the other one is clinical nutrition, and then the third one is food service management. Okay, so when I was a student, I wasn't very good at community nutrition. I sucked at it. But for the past 20 odd years, I'm just doing community nutrition. So my responsibilities are basically, so that means that I'm a very, very important person. Because I plan all the nutrition programs in the country. So there's nobody else who can do what I do, all right? Because we do policies, we do guidelines, we do strategies and plans and so on. And basically also a standard and also, of course, standard operating procedures or SOPs in terms of how the health workers needs to do a certain thing. So basically, it is a little bit difficult because we have very, very few dietitians and nutritionists in the country. Okay? So, but we're doing our best. And with this class that is sitting in front of us now, things will just go better from now on. All right? Now, so this is what I do. Now I'm going to tell you a little bit in terms of how we do the things, what the nutrition situation is in the country, what programs are we implementing, what does it mean, how it relates to the global presentations that you received, that you heard this morning, and so on. So just bear with me, and then afterwards we can talk a little bit about what I've presented and how it links up with what the previous presenters presented. Okay. Now remember, Dr. Mary and Elvis talked about the food and nutrition security policy of Namibia. So we do have a nutrition policy in the country. We are revising that policy, and that's why the date is 2021. Okay, and the first objective of that policy is actually reducing the prevalence of undernourishment. So the definition of undernourishment refers to hunger, reducing hunger. That's it, nothing else. All right, and it is not a definition of malnutrition. Okay, so that is the difference that you need to understand. So when we measure for malnutrition, we use the mid-upper arm circumference. This is this. And we also measure the child's length or the height if the child, this is length. When it's lying down, it's length. And if it's standing up, then we talk about height. Okay? Now, this is now the final introduction of this presentation. Here, we all know this, we've talked about it, you've learned it in your studies and so on, but malnutrition is a major impediment to socio-economic development of a country. Okay? Should I tell you this? Look at countries, developed countries that participate at the World Cup, Soccer World Cup, Rugby World Cup, the Olympics. Eh? Have you noticed those people are taller and stronger than the rest of us? Have you ever noticed? Those rugby players are so tall. Those soccer players are so tall and massive, playing against our tiny little guys. Okay? Now, and then think about how developed they are compared to us, even though we are a upper middle income country, how small we are, how tiny we are, how 5% of the population controls all the resources in the country. I mean, that is unfair, isn't it? But this all relates to malnutrition, to stunting, and to socio-economic development of a country. Okay? Now, our malnourished children are more prone to diseases. You all know that malnutrition affects the immune system, isn't it? You've learned that. If you didn't learn that, you have to go back and ask your money back. Okay. So, and then of course, we will see later a few slides where we talk about cognitive development and physical development, as well as contributing to school performance. Now, if a person cannot perform in school, what does it mean? You cannot achieve your full potential in life. Okay, as long as we agree on that, then it's fine. Now, the goal of our food and nutrition program is actually to improve the nutritional status of the Namibian population. But for us, my program, we only focus on children, women, people living with HIV/AIDS, TB and malaria, in order to reduce morbidity. You know what morbidity is, ne? Diseases and mortality, deaths due to malnutrition or associated to malnutrition. All right, good. Now, our nutrition situation. We talked a lot about stunting, and we will continue to talk about stunting during this presentation. We will talk about wasting, and we will talk about underweight. Now, this slide basically gives a trend of the 3 malnutrition indicators, the wasting, stunting, and underweight. So wasting is the blue one, okay? Wasting is very, very serious, okay? Because if a child is wasted, then it is a medical emergency. The child can die any moment. So that's why wasting is so serious. But if you look at stunting, stunting is the red one. Now, stunting is when a child does not grow to his full potential in terms of his height or his length according to his age. And this is a result of chronic food insecurity, poverty, lack of water and sanitation, all those things. And then underweight is the green one, where this is the one that we monitor when the children are coming to the health facility with their child health passport. You know those graphs on the child health passport. Because we used to have yellow ones, now we have pink and blue ones. Okay? So that is underweight. So this is our situation over the past 30 years, since we've become independent. And you can see that there is a slight improvement. Yeah, 2013 compared to 1992. All right. Now, infant and young child feeding. Now, this is the situation in terms of infant and young child feeding. So here we talk about the duration of breastfeeding. We talk about exclusive breastfeeding. We talk about the percentage who started breastfeeding within 1 hour of birth. Now, this is early initiation of breastfeeding. That is the most important and the most effective intervention to reduce child mortality. Just to put the baby to the breast. That is immediately the first thing that we need to do. Okay? And then we talk about children breastfed at 2 years. So, the Ministry of Health's breastfeeding or infant and young child feeding recommendations are exclusive breastfeeding from birth until the baby is 6 months old. Look how we do. Look how we have progressed. Okay? Secondly, when the baby is 6 months old, then we have to start introduce weaning foods. Okay? And the baby must continue to breastfeed. Now, the weaning food, we call them complementary foods. Complementary foods because it complements the breast milk because the baby still needs to continue to breastfeed. Does it make sense? So, this baby must breastfeed until the baby is 2 years old. Only after the age of 2, then the mother can change now to other milk and take the baby off the breast. Not before 2. If I catch you doing that, I'm going to hunt you down. Okay. So, you see now children breastfed at 2 years. You see we are only at 21%. Because you guys don't breastfeed. Okay? All right. This is the micronutrient deficiency situation. Now this is the worst. Because here, the blue one shows you these children are suffering from anemia. Okay? So, iron deficiency. Okay, there are many, many contributing factors to the fact that these children are suffering from iron deficiency anemia. Because we have malaria. Most importantly is that these children are not eating meat. Okay? It's not part of the child's complementary food diet. So they don't get their iron from there. And then they are drinking milk. Not breast milk, other milk. Milk does not contain iron. Okay, so all this omaheres and whatever that you are drinking, it does not contain milk. Okay? The fat and what is the other one? Oshitaka and all those. It doesn't contain milk, it doesn't contain iron. So, and this is why we have these high levels of iron deficiency anemia. The women are doing a little better, okay? But the children are, and that is a result of the poor weaning food or complementary food practices, and it is a result of the fact that these children are not breastfed until they are 2 years of age. All right. Now, here, when we talk about development in a country, then we need to reduce the prevalence of stunting. Now, what is our prevalence of stunting? You saw it was in the first slide. 24%. So that is a quarter, isn't it, of children that are stunted. Okay. Now the effects of stunting on the brain. Look here. Can you imagine a healthy child, well fed, appropriate weight for his age, appropriate height for his age, and not malnourished. Okay. So you see now with this how the neurons are how they have developed, because they're continuously firing, and then they are making new branches, and you see that. This is a healthy brain scan. Now you see here how few neuron branches are there, because the child is not stimulated, and so on, and because, of course, of the malnutrition. That's why when a child is admitted in the hospital with malnutrition, then play and stimulation is very, very important so that we can get these neurons to fire so these branches can be made. All right? Oh, yeah, you see this one. So this is the normal one. You see how tiny these branches are, and they are everywhere in the brain. And you see here. That's the difference. Very, very serious. So don't play with stunting. You have to, all of us, we need to do our jobs. Like the gentleman was asking, what are you nutritionists doing in the community? Because basically that is what he's been asking every single time. Okay, lifetime cost of stunting. Okay, child mortality. Children are dying because of stunting. IQ scores. You know why the grade 10s and the grade 12s are failing so much? I will hold my tongue, okay? Income, they are saying that us short people are earning less than other people. Okay, next one, the economy, okay? Stunting cost contributes to losses in GDP as high as 16%, okay? So us short people, we are contributing to the gross domestic product of this country. Because we are not earning to we didn't reach our full potential, so we are not contributing to the economy of the country. Does it make sense? Okay. This is what this is all about. This is stunting. All right. Then I wanted to tell you something. In a developed country, people have access to toilets, they have access to clean water. Okay? That's why you see those soccer players and rugby players and those guys who are doing athletics in the Olympics, how tall they are, how beautiful they are when they run. Okay. You ever watch this and just look at them and say, did you ever see the Chiefs play? Nee? Rugby. Wat is 'n agterlyn nou in Engels nou? The back line. And those guys are running. Man, it is absolutely stunning. Anyway, so it's because of the fact that they have toilets and they have clean water. I wanted to show you this one specifically. But I'm running out of time, but I love this topic. Okay? You see this one. You see Irongo. This is Irongo. Okay? Do you see commas? Do you see the stunting levels here in Irongo? Do you see the one in commas? Can you see how it compares to the other regions? Okay. Now, can you see this green line? This is the toilets. The red line is the water. So both in Irongo and commas, both the households, more than 80% of the households have both. They have water, clean water, and they have toilets. Okay? That's why their stunting levels are so low, or lower than the rest of the country. Now look at this one. This is Omaheke. Look there. More than 80% of Omaheke's households have clean water. But look here, the toilets. And you see there, it's maybe 30% or 28%. So, what I'm trying to tell you here is that you have to have both to make a difference in development, in stunting. You can't have only water and you don't have toilets. It's not going to do anything. So in your regions where you're coming from, because these local authorities, guys, they were just elected, they are just in the office now. Go and talk to Job Amopana and tell him to build toilets. I'm using, maybe you should edit that one out. But go and talk to him, because I was in Tobias Hanyeku constituency. Very nicely talking, doing a little bit of research. People have a tap water in their yard, but they don't have a toilet. They have to go to the bush for a toilet. What nonsense is that? Okay, that you can tell him. All right. So I'm going to show you a few images, so you can understand what stunting is about. Okay. Which one of these boys do you think is malnourished? This one. Why do you say that? Huh? The pot belly, ne? Yes. So that boy is stunted. He is 5 years old. Okay, this one is 4 years old. This one is 2 or 3 years old. Can you see that this 2-year-old is as tall as the 5-year-old? Now you see this when you are in the community, ne? Then you see this 3-year-old boy, ne? And this boy, you can send him, bring me a glass of water, give me this, pick up that, and this 3-year-old is just running, he's even talking, he's doing everything that you ask him. In the meantime, the boy is old. The boy is maybe 5 years old, he's just stunted. That's why he can do all. You think he's a 2-year-old that can understand everything that you are saying and can follow directions and so on. The boy is stunted, okay? But he's older than the 2-year-old boy. So those are the mistakes that we are making when we look at at our children in the community. Now this one, this is marasmus. This is very, very, very serious malnutrition, all right? So this child did not receive food to eat. This one is kwashiorkor, ne? So this one received maybe only one type of food, for example, carbohydrates, Albertina semolina, and so on. Nothing else, all right? Albertina, don't take offense, ne? No. So you see now this, how shiny the skin is. Can you see the lesions, the sores on the legs? Can you see how swollen it is? Yes, that is severe acute malnutrition. Micronutrient deficiency. The first two pictures I'm going to show you are vitamin A deficiency. Okay, so with a vitamin A deficiency, the deficiency causes the eye, the cornea of the eye to dry out. Okay, so you can see here it's coming loose. The next one, the person became blind. You see now how serious malnutrition is. The next one is the iodine deficiency disorders. Ne? So you see here that goiter, okay? And the next one is, so this is a mom and a daughter. So the mother has a goiter. She gave birth to the daughter. The daughter was born mentally retarded, and she also has a goiter. You see now how serious micronutrient deficiencies are. Don't play with micronutrient deficiencies. Okay, these slides are from textbooks, and I stole them from WHO, UNICEF, and so training material. So it's not from the internet. Okay, now bringing all of this together is the fact that the Ministry of Health works with the civil society. We are working with the UN. We are working with other line ministries. So next time when we do this again, maybe other line ministries will also be here to present what they do in terms of nutrition, in terms of food security, and so on. But I wanted to show you there. Prof was asking about the definition of food security, okay? And then caring of mothers and children, support for mothers on appropriate child feeding practices, and adequate, and then of course access to health, sanitation, and clean water services. So you cannot divorce clean water, appropriate sanitation from nutrition, and from prevention of stunting. And so, all these things is rooted in political and cultural environment, poverty, and the disempowerment of women. You know, sometimes I wonder, this gender-based violence, maybe it's also rooted in malnutrition, these boys, né? Because that is, malnutrition also must result in behavior problems and so on. Very serious to consider, né? Now, the things that we do in the ministry is basically the essential nutrition actions. So we have to talk about breastfeeding. We have the baby-friendly hospital initiative in the country. Dr. Mary said she's helping us to develop a law to regulate the marketing of breast milk substitutes. Ne? Breast milk substitutes are the formulas and those type of things. And then also we have to talk about complementary feeding. We have to, Albertina's job and your job would be now to make up recipes so that people can actually prepare these recipes as weaning food and feed their children this, and also teach them. And then of course very, very important is the nutrition of women. Okay, women is the backbone of this country. They are the ones that are plowing the fields. They are the ones that are making sure that basically make the farm field and so on for the mahangu, the maize to grow, also the vegetable gardens and so on. The husband is just walking there with a stick, isn't it? Okay. Then also feeding of sick children. Now we have a culture of when a child is ill, we don't feed them I don't know why. Who told our mothers and our grandmothers not to feed a sick child? Because the excuse is the child doesn't have an appetite, he doesn't want to eat. That is absolute nonsense. When a child is ill, that is the time that we have to feed him more regularly. Because of course he's not going to eat a lot at one time. So we have to feed more. When a child is ill, we have to feed more. We have to give them their favorite food, for example, chocolate or ice cream. No, I'm teasing. Breast milk, okay? And then this is, you see here, I was talking about vitamin A, vitamin A supplementation, and then also the salt iodization program. You know that our salt in Namibia is iodized, except the salt for the animals. And this is the salt, those huge blocks of salt that they buy, the farmers buy for the cattle. Those are the ones where we go and steal a blocky and take it home so that we can cook with it. And then of course iron, iron supplementation for pregnant women and so on. In conclusion, I just wanted to show you. So these are the things, the feeding practices and the behaviors, the fortification of food, the micronutrient supplementation, the treatment of severe acute malnutrition. These are the things that the Ministry of Health doing specifically for nutrition. But these are the ones that we cannot do without the other line ministries. For example, agriculture, we cannot achieve a good nutrition or optimal nutrition in the country if we don't work with agriculture. The clean water and sanitation, I will always preach about that. Okay? And then education and employment, of course. And then healthcare, access to health services. The clinics must be close to the home. The mother should be able to access the clinics when they are pregnant, when the child is ill, and so on. And then, of course, support for resilience. Remember when I was talking about the support that WFP is providing and the important initiatives that they are trying. So this will contribute to this, okay? Because World Food Programme works very, very closely with the Office of the Prime Minister, specifically for with the Directorate of Disaster Risk Reduction in terms of supporting communities in times of drought, emergencies, and so on. Even those, and you see now what will happen now this year. We didn't receive enough rain. The little bit of rain that we received too early. There was no follow-up. Now these locusts are there. They are eating everything that is green. They are eating it. Doesn't matter what it is. So they will finish our food. So this is this. So this is with this beautiful mom and daughter, I say thank you very much. So maybe I can have 2 minutes of question time. My time was finished long ago.
Thank you so much for your presentation. It was very informative. There is so much being done to address undernutrition problems, but we are forgetting that overnutrition is also becoming a problem in Namibia, as it accounts for 3.4% of children in Namibia are overweight. Are there any policies, guidelines that are in place to address the problem?
Okay, so when we talk about the NCDs, overweight is the beginning, all right. So, and as you rightly say, I don't know if you can remember, in Dr. Mary's presentation, she was talking about the goals, and she was talking about obesity should be, childhood obesity should be maintained at 5%, and that Namibia is at 6%. So it's a very, very good question that she's asking in terms of what are we doing. So for us, we've incorporated into our food and nutrition security policy, okay? We have highlighted extensive actions, activities and interventions that we can do to address obesity, childhood obesity, including making sure that children actually have access to or doing, you know, that physical education period that we used to have at school, and most of the time we used it to do our homework, isn't it? Oh, you were not like that. You were very good anyway. So those are some of the things. And then these activities that we are talking about in terms of breastfeeding, in terms of the introduction of complementary feeding, the continued breastfeeding up to 2 years and beyond, all those are interventions that will address or prevent obesity. Okay, I know Ministry of Youth also have programs related to, there they focus not on obesity but on physical activity, on exercise and so on. So those are some, very few of some of the programs that we are focusing, but it's a very serious problem, okay? The obesity, because it contributes to resulting in diabetes mellitus, hypertension, cholesterol, all those things, and which are at risk factors for heart disease, and of course also increasing death and so on. So it's very, very serious, a very good question. Next time I will talk about that. Okay. There's something that I wanted to say about the I think it was Dr. Mary's presentation. So WHO provides technical support to us. So that what it means is that they provide us with technical experts, people who know. So what Dr. Mary and them are doing is they are helping us in terms of coming up actually with the guidelines, the policies, and so on. And then somebody else have asked about research also. So usually also they will give us somebody, a technical expert, in a specific topic that we want to research on. So this expert will actually help us then to be able to develop the proposal and making sure that we correctly do the research, and so on. And with the ministry, with the nutrition program, so with if we have certain ideas in terms of research topics that we want to do, so we would gladly work with the nutrition program as well as with the universities, both the medical school and with the faculty of education, and so on, in terms of the students doing some little research projects so that we can get information. Nobody commented on the fact that the statistics are so old. So actually those are some of the things that we need to get more information, and it will guide us in terms of how to improve the programs that we are implementing. Oh, and the other thing that I wanted to explain to you is that scaling up nutrition means that we have to reach every mother and child in the country. That is what it means. So, and why we are struggling to reach every mother and child is because we don't have the manpower on the ground. So that's why you as nutrition students, well, once you've qualified, you work at the civil society organizations that you can actually be our person on the ground to be able to reach every mother and child. Another thing also is that Namibia is a country that has unique challenges. Nowhere in the world do we have a country that has an ocean. Next to the ocean is a desert, and then we have another desert, and then we have certain only small areas where we can grow, but a fertile soil that we can grow food and so on. So and then of course the sparsely populated country and so on. So and I think those are some of the issues that contribute to the fact that we are struggling to reach every mother and child.
Good morning, everyone. Thank you for addressing that based on the statistics, because I was going to comment on that. Are we going to get new updated statistics on all those important things that we have discussed on the table? So I was just really concerned about that, because it has been since 2013 and we're in 2021 now. So do we have new updated statistics coming soon so we can be able to know how far we have improved throughout the years?
Fantastic comment, all right? So my statistics are the official statistics from the Ministry of Health and Social Services, okay? And We call it the Demographic and Health Survey. Now, this survey is supposed to be done every 5 years. So, 27, we were supposed to, 5 years later, it was supposed to be 2012. It was only done in 2013. From 2013, 5 years later, it was supposed to be done in 2018. But you know the economic situation in the country. And if we have funding or money challenges or budgetary constraints, what do? Statistics is the first one that we don't address. And it is unfortunate, it's not supposed to be. That should be the first one that we actually pour money into so that we would be able to monitor progress and to better plan with the limited resources that we have. So thank you very much for that. Brilliant. All right, thank you very much. I love it. Thank you, Ben.
Nutrition, 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 nutrition.